At Mount Sinai Heart, optimism is everywhere. As a unit secretary, I see the enthusiasm my coworkers have for their jobs. It's so infectious and translates directly into department successes. In the Arrhythmia Institute, our patients come from far and wide to take advantage of our evolving world-class services. What makes us great are our doctors, nurses, technicians, and staff who are unafraid to bring attention to needed improvements that enhance patient care or personal protection and well-being. Sometimes, a patient just needs someone to listen to them and hold their hand. A warm smile or simply leaning in can help someone see the silver lining and move on with their day. Together, we can build a better community and a better tomorrow.
At Mount Sinai Heart at Morningside, we work collectively and synergistically towards a shared goal, enhancing patient safety, satisfaction, and outcomes. This teamwork spans across numerous departments, but at the core, the foundation of our effective teamwork relies upon commitment, accountability, and trust. In my role as the cardiac surgery pharmacy specialist, I serve as a member of the multidisciplinary ICU team. I evaluate all aspects of the patient's clinical condition to make informed decisions regarding safety, effectiveness, and evidence-based medication management. However, this is just one small part of a larger, multifaceted team working in tandem in compelling direction towards enhancing the patient experience. Together, we ensure optimal patient outcomes, every patient and every time.
Agility, to our point of view, is being flexible and able to adapt to support the areas we service. We pride ourselves in having the opportunity to work with our clinical team. I believe it's a comfort to the clinical team knowing that we, materials management, will always be there to help support and make changes regarding supplies and equipment that will ultimately result in the best for patient care.
In the cardiac ICU, we take care of patients and families who are facing complex and often life-threatening situations. We understand that when a person comes to Mount Sinai and places their health in our hands, that's a sacred trust. Safety is our number one priority. We strive to achieve the highest levels of safety by listening to patients, listening to each other, working together as a team, and studying continually how we can get better.
The definition of empathy is the ability to understand how others feel. I embody this value within my nursing practice by understanding how my patients feel. As a breast cancer survivor, I was also a patient. So I truly understand how it is to be in that bed and to have numerous people come in, doing medical procedures, explaining to you what's going on. So as a nurse, I tailor my patient care by using empathy. I want patients to understand that I know how it is to be where they are, to perhaps feel fear, to feel anger, to be sad, perhaps even to feel that your body has betrayed you. Using empathy as a forefront of our medical practice allows us to provide not only medically top-notch care, as Mount Sinai always does, but also to deliver care with compassion. Our patients need compassion, and that sets us apart from any other healthcare institution, that we are empathetic healthcare providers and we holistically take care of the patients.
In my role as a cardiovascular tech in the cath lab, I'm always thinking of new ways to make my job process easier and more efficient. I am responsible for the upkeep of my surroundings in order to maximize my time and the use of my space. I learned the technical layout of the lab, and I bring my concerns to the management whenever they arise, especially when it comes to patient safety. By engaging in timely, respectful communication with management, we are able to solve any issue that may arise. There is always open dialogue. It is very rewarding working for an institution like Mount Sinai, where you get to be a part of the creative process, where management listens to your ideas and they go as far as instilling those ideas that are beneficial to the institution.
As a nurse practitioner at Mount Sinai Heart, it's important for me to practice transparency. As a provider, being transparent is very important to me because it helps me stay accountable, informed, and honest in my practice. Transparency for me means that I'm building trust and relationship with patients as I daily interact with them and stay open with the care I'm providing for them. For example, I share my patients' information that can help them make the right decisions, and I'm honest to express some of the effects of poor decisions. Working with members of the team, such as nurses, doctors, and supportive staff, requires me to be open and honest about challenging patient situations. This has helped me to have a good working relationship with the staff at Mount Sinai. We at Mount Sinai Heart have an open policy to be transparent, to promote quality patient care, and to incorporate transparency in our daily practice and routine.